All
Right.
right. So first, we'll introduce our host. I already introduced myself. And for those of you all who actually don't know, Trusted is a travel nurse company that places nurses in all 50 states. But amongst that, we also have a wealth of community and career resources, as well as these events. We also have a lot of blog resources. If you guys are ready to start travel nursing, if you guys have any other questions regarding travel nursing or how else we can help you, don't feel free to email me after the presentation, and I can also help you with that. So today we're going to talk about protecting your income, leaving a legacy, and making a solid financial plan. I know we've all been there. I'm there currently, so we're just trying to get everything right and together for you guys. So we are so thankful for Equitable Advisors here with us today. And without further ado, we'll get into their presentation.
So I'll start it off. Hey guys, I am Janee Browne. I am a financial advisor here at Equitable Advisors. And just to start, I graduated from the Clark Atlanta University. So if there are any other HBCU grads, hey guys, I'm also a member of Delta Sigma Theta Sorority Incorporated. So if there are any of my lovely sorors out there, ooh, to you guys. But I've been in the financial services industry for about 11 years now. And I focus on helping my clients save, invest, and protect their assets by creating a solid financial plan to help them reach their financial goals in the future. In my spare time, I love to travel. I love to spend time with my 4-year-old daughter. And a fun fact about me is I wanted to be an actress my whole life. I didn't get my big break yet, but I was featured in a magazine when I was younger. And funny enough, it was about kids minding their own business. But if you guys do have any questions or want to talk later, we'll provide information for ourselves later on in the presentation. But my Instagram is down at the bottom. And
All right, everyone. Thank you for joining us. I'm Olivia Morrisland. I've been in the financial industry for about 4 to 5 years now. Same firm, Equitable Advisors, and currently one of the vice presidents at the New York branch. Technically, what I end up doing with clients is pretty much show them how to invest in the stock market by building a financial plan. So I work with mostly medical professionals and business owners by helping them minimize their tax liabilities and creating legacy plans to leave behind and protect their assets. I find pleasure in helping my clients maximize their actual finances and investments to continue to expand their wealth. Fun fact about me is I'm actually a producer of a talk show. So Janee, listen, next time you want to act, next show I produce, you could come through.
thank you.
And my Instagram is at the bottom if everyone, wanted to kind of look me up on Instagram as well.
All right, all right. Hey guys, my name is Tianna Robinson. I've actually been an advisor with Equitable here for coming up on about 4 years now. And for me, I personally specialize with business owners and medical professionals. So I found that that's my sweet spot, really connect with those individuals the most. And what I really find often is that, as medical professionals, you guys are placed in a great position to really max your income. But unfortunately, we're just not given as much financial education as we deserve, right? So what I like to do is really go over how can we accumulate our wealth, how do we protect it, and how do we make sure that we can put ourselves maybe in the best taxable situation. And when I'm not doing all of that, I do also love to travel, and I love a good Sunday brunch. So if anybody wants to fly to New York and we want to catch brunch, just give me a call. All right. My Instagram's at the bottom as well.
Oh, and Tianna didn't say it, Olivier did, but you are in the presence of 3 vice presidents today. So
You are.
so all right.
So we've got today 2 important questions I want to ask you guys. So I just want to make sure everybody's awake, had their coffee. I want to keep you guys a little bit engaged, all right? So I'm going to ask you to think about these 2 questions and you can just type your answers in the chat, okay? So the first question, if you become hurt or sick, God forbid, what resources do you currently have at your disposal to help you get through that rough patch? So I want to leave a little bit of time. Just go ahead and type your answers in the chat. What resources do we have if we do become sick or hurt right now? All right. So you guys can kind of start typing that. The second question, are those resources adequate enough for the needs of myself or my family? Okay, so hey, God forbid I get hurt, I get sick, income's not doing what it's supposed to do. I can't physically work the same way. Is what I have enough in place to take care of my family? All right. If the answer to either of those is no or I'm not sure, that is why we are here today. Welcome to our stage. Okay. So what you'll notice here, right, we tend to accumulate a lot of different assets. What are the things that we find are most important across life? A lot of people say we want to build retirement plans, want to have personal investments, we want to save, right? Get ownership, pass these things on. But none of these things really can happen if we don't have income. So if you notice, when we look at this chart here, the basis of it, of our kind of plan or the foundation, is about protecting that income, right? Or in other words, disability insurance, right? So if we understand, hey, income is our most valuable asset by far, we're going to do everything in our power to protect it, right? And then from there stems all of the other things that we want to take care of, okay? So what does our income do for us? Not only does it provide for our day-to-day stuff, right? It's the big and little things that we tend not to think of. So how do we break that down? Well, income pays for our housing, right? It gives us a roof over our heads, pays for the education, right? The education we needed to step into the space that we're at today, and maybe the education we're going to take further. Our lifestyle, our health and fitness, food, even the devices that we're watching this on. We need income to fund each and every one of these areas. Okay, so this kind of really just reinforces that valuableness of it. All right. Next. So imagine this. Imagine you're 35 years old. Someone who's 35 is making $75,000 a year, doing relatively well for themselves. By the time they're 65, they could expect to earn $5 million. Now, I don't know about you guys, but if I got a $5 million check today, I'm going to do everything in my power to protect it, right? It's safe to say we're going to guard it. We're going to hold it, cradle it like a baby, right? So when we look at these things, we really got to step back and ask ourselves, well, if income is going to breed that much over our lifetime, and if it's worth so much, why don't we protect it? What do we have in place right now to take care of that for us, right? It really starts to make you think, right? So let's talk about that. How do we protect our income? What are the things that are out there available to us, okay? So we can't predict the future. It's safe to say, unless we've got some secret superpowers on here. And if you do, I want you to just give me a call and tell me how I can get them, right? But none of us can read minds. None of us can predict the future. And believe it or not, most disabilities are not caused by accidents. Most of the time we hear disability, we tend to think of a car accident. I broke my leg, I flipped and I tripped and fell. But honestly, that's far from the truth, right? 25% of disability claims come from musculoskeletal system disorders, right? 15% are from mental nervous disorders and substance abuse. So how many of us real life know someone who may have suffered from anxiety or suffered from depression, someone who maybe has a substance abuse problem? 15% of these things come from that, right? Another 18% to the nervous system. So just unfortunately throughout life, you ever hear somebody say, I got a pinched nerve, I got sciatica, my bones just don't do what they're supposed to do anymore. All of these things are really the main causes of disabilities, right? It's really not hey, I got hit by a car so much. It's crazy, but only 8% is actually from injury, right? And when you look at this kind of chart and you really think about it, it's like, wow, most of the things that are causing these disabilities, I know people who have suffered from that. I know firsthand, hey, you have gone through that, my uncle, my cousin, my aunt. So you really want to take those things into account. All right. So what can a disability claim actually look like? Let's use an example. Let's say that we have a 30-year-old physician, right? He gets disability coverage. He wants to make sure he covers his bases. By the time he comes to 34, he has a vision problem, vision impairment. He puts in a disability claim. That will take him through retirement, that claim, and he's paid out $1.24 million. Because what's the disability claim doing? We're protecting the income. Hey, you can't do your job the same way that you're used to. Let's make sure that your family's still protected. You can still take care of the things that you need to do. All those other areas that we looked at or factor in, and we make sure that we'll pay this physician out month after month, right? You want to look at maybe a separate physician. Let's say they're not that young. We get it while we're older on, right? And unfortunately, he goes into cardiac arrest. We need to pay that man out as well, right? If we got a young lady that's an attorney, right? And unfortunately, at 46, she got HIV. that's a disability as well. We had to pay her out $534,000, right? So there's so many scenarios that you can look at, right? We've got lose biz, even asthma can be considered a disability. And if they're going to hinder our performance, we can work with it. All right. So these are just some really prime examples of, again, maybe not your typical thought when you hear disability, but things that are real life scenarios, right? Things that have actually happened. And you can really just see through the chart, well, how well taken care of were they, right? That'll obviously depend on the types that you get and, the tricks and trades of it that Janee is actually going to dive into a little bit more. But I just wanted you guys to really see the importance of this, right? So, and as all of us go through this conversation today, again, this chat is your friend. I want you to drop in all the comments, all the reactions, anything that's on your mind, start throwing them in there. All right. So now that we've talked about what it is, why we're protecting our income, I want you to just think on this last note, what it can look like, right? In its simplistic form. If we're working, we're making income steady, maybe we get some raises, our income's going up, right? But if we're injured, we're not working, the income starts to decrease, right? What you'll notice is typically our income is here, our expenses are here, right? Expenses are not meant to bypass our income. But as unfortunately, if we become disabled and the income goes down, the expenses actually tend to increase. So you're probably asking yourself, well, why would they? I didn't change my housing, right? You got to think about the base level. What are my typical expenses? I still have to pay for food. I've still got to pay my mortgage or my rent. Still have a car note to pay for. Still got childcare, everything that I'm used to having. But now I'm doing everything in my power to go from being injured or on a disability to getting back to full health or optimal health. How do I do that? I might need rehabilitation costs that I didn't think about. There may be extra copays I have to go through for seeing the doctor, so much more often, right? I may need an in-home aid, right? And these are things that I wasn't thinking about that I now have to start to pay for. So a lot of times we tend to see those expenses start to skyrocket while our income is decreased. And if we haven't planned for that, it's really going to hinder us and set us back. All right. So you're probably wondering, well, that's great. How does this income protection actually work?
And that's what I'll be talking about today, how the income protection works. So when you're talking about disability or what disability insurance actually does, it just works like a paycheck. It provides a monthly income to you to cover those daily life expenses. Like Tianna mentioned, still having to pay for food, your home, whether it be your mortgage, your rent, your phone, your car. What it does is it just fills the gap and basically covers the expenses that you would have or just your income. So if you were to get sick or injured and your income goes from, $5,000 a month to zero, what do? The disability insurance will cover the gap so that it will provide you with that maybe $4,000 to $5,000 of monthly income so that you'll be able to continue to pay for the things that you would normally pay for. So a disability policy, it can be customizable to you. So for anyone who has additional questions, of course, we can answer generic questions, but typically speaking, it's customizable to you and based on how much you make, your age, what type of work you do. Now you guys are travel nurses, but depending on how high risk of an area you're in, that could determine the disability coverage that you're eligible for and the cost for it. As a travel nurse, I know some people may not be in the best work environments, and you could be at high risk for getting injured just based on the patients that you might be working around. And so if that's the case, then, we might need to increase your disability coverage, or you could be in a safer environment. It doesn't mean that we necessarily decrease it, but it could just be more cost efficient for you, depending on the type of work that you do. Also, no matter what job you are at, I know a lot of travel nurses may work with different agencies or in the same agency, but at different locations, but it stays with you. It goes with you wherever you go. And whenever that disability claim does come up, that's where you can trigger the disability claim and then start to receive that monthly income. And then the payments do end at retirement age. So you'll get the disability income as long as you are in your working years, and then the payments end at the retirement age. So you guys are nurses and could work for the agency or what other, you might have certain disability benefits already through your employer, depending on who your employer is. If your employer covers 100% disability, then you're golden. But most jobs cover between 50 and 60%, and you still pay taxes on that. So if you are used to getting, say, $5,000 a month, if your job covers 50% of that, you go from $5,000 to $2,500. Now you can ask yourself, you can write in the chat. Unfortunately, I can't see the chat right now just because I'm presenting. But if you were to go from making $5,000 a month to $2,500 a month, would you be able to live off of that? Especially with you being injured, you may have additional fees that come from like hospital visits or doctor visits, but your mortgage still stands or your rent still stands. You still need your cell phone, you still need to eat, all the things that Tianna mentioned. But having half of your income, that's where she mentioned your expenses becoming less than your income to now being more than your income. Disability insurance covers that gap between what your job might offer to what you need in terms to meet your needs on a monthly basis. Another thing that's impacted by disability is your ability to save for retirement. Like Tianna mentioned before, your greatest asset is your ability to earn income, and just at $75,000 until you're 65, you can make about $5 million. Well, if something is disrupted in that time period due to a disability, that could impact your ability to retire when you want to retire with the amount of money that you want to retire with. Since oftentimes when you do file a disability claim, if it's a long-term disability claim through your job, you may not be contributing to your 401k. You may not have the ability to contribute to like an outside retirement account because you may receive half or none of your income. And then your employer match could be affected based on the disability claim. So if you think about this as well, if you're used to just $5,000 as an example, making $5,000 a month, and that's after taxes, that's in your pocket. Well, the money that's before taxes, some of it might have been going to a 401k and your job might have been matching. Say if you were putting in 3%, your job was putting in another 3%, that's 6% of your income that was going towards your retirement, that's no longer going towards your retirement. Think about 6% of your income every year with the growth in the market. That could change your retirement date from 60 to 70 in an instant based on how long you're out on your disability claim. So the disability insurance can cover the gap so that you can still contribute to certain retirement plans as well. And then there's certain disability coverage that can provide that retirement security to pay you out through your retirement as well. So when it comes to talking about disability and how it affects your retirement, Olivier is going to talk more about the overall, why it's important to set up the overall financial plan. The retirement piece goes along with that as well. But just strictly from a disability standpoint, if you were to have, earned income, been contributing to your retirement, and then at age 40, you have a disability claim. Well, that's the difference. You may have about a $1.2 million loss if there's no disability insurance to cover that gap. So like Tianna mentioned, making $5 million, you would want to protect that with everything that you have. Imagine taking just a $1.2 million loss of that off the top, just from having a disability claim at age 40. Some people it happens earlier, some people it might happen later, but you would want to protect that $1.2 million loss, and that can be done through certain disability insurance that could protect that gap between your monthly income and then also help you save for retirement. This slide is also going over the same thing, the difference between you paying, your monthly payments and having the disability stop in retirement, or you can have the disability coverage that provides you with that retirement security that takes you through your retirement years. And again, this is all customizable, something that we can kind of talk to you guys about on a one-on-one basis to see kind of what makes sense for you based on where you are in your career, the type of environment that you're in, and then how much coverage you actually will need based on your monthly needs. Olivier is going to talk about your life insurance and or leaving a legacy through life insurance, and then also the importance of setting up a solid financial plan. I'm going to stop sharing my slide now just because he's going to kind of talk and have just a candid conversation.
Perfect. Kudos to Janee and Tianna for the amazing presentation. So just to segue really quickly from the income protection play now to the wealth protection play, right? So I feel like as far as planning goes, so far, the biggest thing I feel like is the most overlooked part of it is protecting the actual assets you've actually built. Okay. And the reason why I say that way is because the biggest portion that's overlooked about it is the life insurance portion. Okay. We spoke about disability income protection, which is the disability insurance that protects what you're currently bringing in at this moment, right? But what happens over the course of your life with all the assets you've built? Okay. Where do we leave those things? Now, most people kind of think of an insurance play as just, okay, well, it's just for one thing, right? God forbid I pass away, my beneficiary gets the money, and that's it. But actually, you could use an insurance policy to actually invest in the stock market with, just like you would in a 403B, right? Most of you guys probably know what that is, or an IRA, like a Roth IRA or anything like that. So let's compare the two really quickly. We have your term insurance, which is what most people usually know. I get that it's the cheapest way to actually have life insurance. It lasts for a certain amount of years. So let's just say I have a 10-year term policy. 10 years come about, that goes away. But in the meantime, if I had passed away within that 10-year time frame, my beneficiary would have received the death benefit. Okay. Now, think of it this way. When you guys go get a new phone, the new iPhone 13 or whichever one, I'm lost at this point because they all have like 4 cameras. But before you leave the store, they usually ask you, do you want to protect that, right? By putting what? Insurance on it. When you get a new car, before you actually leave the lot, you cannot leave the lot without actually protecting the car, which is putting insurance on that car. Same thing for a home, okay? That's where the permanent insurance comes into play. That lasts you your whole life. So think of the term insurance, like I mentioned earlier, like a liability coverage on your car, right? You have it just to have it for now. God forbid something happened, the insurance company pays out the claim, no problem. But you could actually build assets inside of what we call LIRP, which is like a life insurance retirement plan. Okay, now, most of you guys, right, especially nurses at Trust Health, because I work with some of them, are actually making pretty solid money. Most of you guys probably heard of a Roth IRA before. Okay, now with the amount that you're making, you probably wouldn't want Uncle Sam to actually touch every single dollar, right? So just by a show of hands, or if you want to type in the chat, are you guys really happy with the amount of taxes that you guys are paying on your income? Okay. You can answer that. We could circle back. I'll follow up on that. So most of you guys, as far as planning for retirement goes, you probably have heard of a Roth IRA before, which is probably the best way to invest. But Roth IRAs actually have a limited amount of income you can make per year. So what if you're making $140,000 as a single person, or 208, right? 208,000 as a couple. You are no longer allowed to put money inside of a Roth IRA. That automatically takes away that option. Okay. Now, what if I told you could use an insurance policy, which we kind of call it the Super Roth IRA, because then there's no income limit to it. Okay. So how exactly does it work? You still get the death benefit portion. So God forbid you pass away, you're still covered regardless. Your wealth is protected. Your beneficiary still gets that death benefit. Okay. Now, where it comes to play is at retirement, you could use it as an asset. Now, you've put money over it, the money has grown, and then down the line, you could start taking money out of it on a tax-free basis. Okay. Now, keep in mind, there's no income limitation to it. So it kind of gives you the option to where for the people in here, with some of my travel nurses that I work with at Trusted Health are blowing that income limit out the water, where does that leave you as far as planning for retirement? So like I mentioned, I feel like that's the biggest part of it, because most people protect everything that they have: phone, homes, cars. But who's the biggest asset overall? It's you, right? Because without the actual money you're bringing in, if you can't go to work, like Janee and Tianna were mentioning, where exactly does the income come in? There's no more income. So it's kind of that kind of play where you have to protect yourself, since you're the bigger asset, because without you, none of these things actually exist, right? So that's that portion. Now, just to step outside of protection in general, let's talk about a whole financial plan, right? Creating an actual financial plan. So everything that we're talking about right now is on a case by case basis. It's not just a one fit all type of plan, right? So what happens when you're building an actual plan? Let's say you're working with an advisor. The goal is to pretty much identify the goals that you're looking to accomplish: short term, long term, anything that you wanted to get done in the next couple of years, all the way till 20 years from now, way down the line. We can't predict the future, but at least we could kind of prepare for that, right? So just like we spoke about income protection, which is a disability play, God forbid something happened, we're protected. Just like we spoke about the wealth protection, to protect all the wealth we've put in. But there are other things I'm sure you guys probably would want to accomplish, outside of those. So maybe starting a business. A lot of you guys are nurses. Do you guys ever plan on becoming a nurse practitioner and opening up your own practice? So how do we transition from being a travel nurse to opening up our own practice and making sure the finances are in place so the practice could run as smoothly as possible, right? There's also the long-term care status of it. You guys are nurses, so you guys are probably aware. God forbid you can't perform 3 of your 5 daily living activities. What happens then? Do you go to a nursing home, or could you have an aide come into the home to take care of you, right? So that's where the holistic financial plan actually comes about. So that's where Janee, Tianna, myself would step in and say, okay, well, on a case by case basis, based on the goals that you're looking to accomplish, this is exactly how we prep for it. And in that case, if it requires us to put retirement plans together, short-term investments together, budgeting, savings, and proper planning to allow us to accomplish each goal, and in that case, we are prepared for any scenario that could happen down the line. Okay, it's better to be safe than obviously sorry. So that was just my part. I'm gonna leave it up to you guys to ask any questions that you guys want to, whether myself, Janee, or Tianna, or even if Brittany want to step back in. So I just wanted to tie up everything fully together, because outside of the first 2 things that we discussed, it's more important to actually put together a whole plan. And in that case, you're ready for every scenario that could possibly happen down the line.
Well, I'm just going to say it. That was well said. I definitely loved it. So like Olivier mentioned, this is definitely the right time. Ask questions, get involved, whatever's on your mind. We're definitely here to answer and address for you. Britt's going to kind of take the stage right now, but we're all here for you guys.
Janee, will you go to the slide with you all's contact information, just so people can jot that down? We did have a question about that. Does anyone else have a question? You can just type it in the Q&A section. The only thing I saw above was someone asked about pre-existing conditions getting worse.
Okay. So I also, they're starting to flow in, so I'm gonna let them kind of come in. With the pre-existing conditions, it'll vary carrier to carrier what they are willing to take on, pretty much. So when you think of insurance as a whole, whatever area it is, whether it's car, life, disability, the other word for it is just called risk management. So if we have something that they find is already deemed quote unquote risky, they may just increase maybe the premiums that are required. Doesn't mean that it's fully off the table though. So what we would kind of help you do is let's just weigh out the cost to reward ratio, right? Is it worth paying X for me to get Y? And that's all going to be case by case. We never really give generic information on a public platform like this, but we would sit down, hey, what exactly is the condition? Let's kind of look around from place to place, right? The beauty of really working with an advisor, especially like one of us, is that we are brokered out. So it's not just, hey, you have to sit with this one carrier. Based on your situation, I'm going to let you know, well, these guys are great for you. These guys maybe not so much, right? And then we can make that decision together.
Does disability insurance have to be tied to an employer, or can it be a private policy?
When you guys want to take that, I'll
I'm
go.
gonna take that. I could take it, whichever one.
Yeah, so it's not tied to one company. Your disability coverage that you get is tied to you, and you can take it wherever you go. So it doesn't have to be affiliated with just one company. Also, Tianna, I know that kind of ties into, I don't know if you want to explain how you can actually continue to work and get disability as well.
So without getting like super complex, there are two broad areas to consider when you look at disability insurance. One is called any occupation, where generally speaking, hey, listen, you're disabled, you cannot work at all, X, Y, and Z. We're going to pay you out a claim month to month. You'll get your income. There is also something called true own occupation. Why is this important specifically for nurses? A lot of us start out in a hierarchy system. You start out as an RN, you decide I want to go back to school, I want to now become an NP, okay? What happens if I make it to that status, God forbid I get injured and I cannot work as a nurse practitioner anymore, but I can still work as an RN if I wanted to. If you have a true own occupation policy, 9 times out of 10, what they'll do is say, hey, listen, you can't work in your specific field. I'm going to pay you out no matter what else you're doing. So why is this pivotal or really crucial? You could still go and collect other income, right? You just can't work in your specialty. You see what I'm saying? Or you may imagine being a neurosurgeon, right? You really rely on your hands and you get a bad hand injury. You're not going into anybody's brain at that point in time, not safely anyway, right? Not if we don't want to get sued. But you can still give generic advice as a regular physician, right? As maybe a pediatrician, you can still speak, right? So you may be out on claim as a neurosurgeon, but you can still collect income just as a physician. So that's really a key point, and what really kind of makes you guys so special is that you can at that point in time potentially even make more than you're used to on the regular. And I'm not going to say to milk the insurance, but at least hey, I do have options. I don't totally have to take a step back. All right. Thought that was something you guys might want to know.
I just have something I wanted to add. I know, Britt, you're doing the questions, but this is the second question I've seen. If you're 60, is it too late to get these benefits? So I kind of wanted to jump in on that because I feel like a lot of people are asking about it. So just to answer the questions, no, it's not too late as far as age-wise goes. Okay, so there are a lot of factors that comes down when it comes to overall planning and any of these things, whether it was income protection or disability. So even if those factors kind of exclude you and you're not able to get those, there are always alternatives that allow you to still maximize on, your amount of years that you've worked and the amount of assets you probably still want to generate down the line, even if you're still working. So just to kind of lay it out there, no, it's not too late at all, whether you were 60, 65. Because for everybody, literally, there's always an alternative that we can kind of find and go to still give you, what you're actually looking for, if that makes sense.
All right, so that answers that question. Thank you. What to look for in a good financial planner and how to find one locally?
I like that. Janee, you want to take it or you want me to take it? Because I like that one.
You can take it. I'll just add my little 2 cents on the back end.
There you go. So that's a great question, first and foremost. When it comes down to it, I tell people to treat it like any other profession, any other area. Hey, how comfortable am I with this person? When we have our conversations, whether we set up a pre-consultation or anything, do I feel that they are addressing me directly? Are you addressing my needs? Do you make me feel comfortable, right? If I'm going to talk to you about my finances, we should have some form of a trust, A, and B, a comfortability by foremost, all right? So that's the main thing. Now, when it comes down to what to look for under the hood, well, what are some deeper things? I mentioned earlier that, one of the beauties of us working where we work is that we are what we consider brokers. So we're not tied to one particular sort of industry. We're not tied to one particular company. If I find that, hey, this is not a good fit for you, I can provide you with 10 or 20 different options, right? So you don't feel pressured to say, well, I have to do what's in your scope of work. I have to do what's in your realm. I have options now. So that's something that may be pivotal. Are you gung-ho to the company that you work with? Or do you have options? Can you do what's best for me, right? Ties me to the next word. What is a fiduciary? So by law, all three of us, we are fiduciaries. We have to legally do what is in your best interest. And if we don't, there's a website called Broker Check where you can go online, put in complaints, and then my license will be gone. All right. So how transparent are they with that? Right. Are these are things that I want to have on my side. As far as finding one locally, I can safely say for all of us, we do work within several states, all 50 states. The beauty of, the upside of the pandemic, a lot of virtual things just like this, right? Where if you're comfortable with it and you're okay with meeting virtually, we can. And if you needed one of us to kind of come out and meet you in person, we could also do one. So the simple answer is really finding the Google search and diving further in. Okay, now that I found different people, do I feel comfortable? Are you doing what's in my best interest, right? Are you licensed to do so? Will you meet me on my terms? If I find that, hey, I don't like virtual, but I want to meet in person, are you willing to come to see me? Right? Are you willing to work with my schedule? Those are kind of the factors that I feel are definitely what's important. And speaking for all of us, we've all gone to Cali to visit clients. We do all have clients out there. I've got clients in about 15, 16 different states. So we're more than willing to kind of work with you guys. But generally, those are what you want to look for from everybody. And I know Janee has some stuff to throw in there.
Honestly, you touched on 99.9% of what I was going to say. And I would just start with who's in front of you. We're in front of you as, your first process of elimination before you have to go to Google or before you have to go anywhere else. So you can vet us as first, and then if you don't find, the personality doesn't work or whatever, then, use us as your guide to kind of, help you answer questions that, may need to be asked to other advisors as well. Also, I would make sure it's not, most people don't go up to people and say, hey, what licenses do you have? But also some advisors are only licensed to talk about mutual funds. Some advisors are only licensed to talk about insurance. Some advisors are licensed to talk about your stock portfolio, mutual funds, fixed income, insurance, the whole 9 yards, so we can create a full financial plan for you. Fortunately, all of us on the call are fully licensed advisors, but that is something you definitely want to look at. And Tianna mentioned Finra Broker Check. You can check an advisor's license on Finra Broker Check to see how long they've been in the industry, if there have been any complaints on the investment side of the business. And then just making sure that an advisor can offer insurance as well, because that is a part of your full financial plan.
Great advice. Thank you. How do you decide how much coverage to get when income can vary while doing travel nursing?
I'll take that one. So there's something called adjusted gross income. Okay, it's called AGI. Okay, now that's a financial term, but just to break it down really quickly, it's the amount of income you've made for the year based on, and after your deduction. If we've made 100,000, we're 10,000, your adjusted gross 90,000. Okay, so that's what that represents. Now, based on that 90,000, that's the income based on pretty much the coverage off on. Because what's going to happen is, especially for the travel nurses, you guys are, I believe, W-4s, right? So you have to actually deduct taxes down the line, and so that's what's always going to happen. But once you deduct, that gives you your number, which is, and whatever that number is, that's what we actually say, okay, well, based on what you made, the amount, this is what your actual income is, this is what we build the plan off of, and this is what we actually give as far as coverage goes.
Perfect. Can you give us an example using real amounts for premiums and benefits for life insurance that becomes an asset?
Who's taking this one?
Can you repeat the question, please?
Are there any examples using real amounts for premiums and benefits for life insurance that become an asset? I believe, yeah.
That would have to be shown as far as, like, we know, your case by case basis. We're licensed, fully licensed. Any real examples of past, it would have to be price and asking. I question where we wouldn't be able to use unless it was a direct one-on-one, because that could get us in trouble. And then if you go on broker check, people complain about it. So that's how it goes.
Also, when it comes to it is very specific, but generally speaking, the way using that policy works, it's overfunded. It also depends on market conditions. That is a determining factor as to how much you would possibly be able to withdraw in the future too. But general information, the more you put in, typically the more you get out, and the less you put in, typically the less you get out, so to speak.
Yeah. I think last piece I kind of add on that, again, kind of like what Olivier was saying, is it has to be case by case, right? It's specific to you. But the fact is that we kind of incorporate what are you looking for? So like Janee mentioned, well, what are you really looking to get out of it in the back end? What's our current standpoint, right? Did we factor in your current expenses, your living situation? If we're on travel assignments and have like COVID hazard pay, did we factor that in versus your other forms of income where it would kind of level out to? And once we really factor in all cases, then we would kind of give you the recommendations of, okay, if you did this, this is what it can look like, right? It's all about comfortability at the end of the day. What's comfortable for you personally, but also what's comfortable within your current situation. So it's, it could be a matter of, hey, well, I love this and I want to put in $1 bajillion. Great. But if our financial situation doesn't allow for it, legally, we're going to have to let you know, like, okay, listen, that's not the best move for you. So it really depends on a lot of those different factors. But again, sit down on a one-on-one. We can always show you, we call them illustrations, what it would look like. So it's like, hey, hypothetically, this is what you wanted to see. This is what can maybe make sense for your particular situation. Here's 1, 2, 3, 4 options. That's what you can expect. So hopefully that all kind of clears it up a little bit.
How does it work if you're a travel nurse and run your own company?
First of all, kudos to you.
Yeah. I mean, I think that's great because there are other options that can be done. We didn't touch on the different types of accounts, but in terms of retirement planning, there's other options for you as a business owner that can help reduce that could potentially help you reduce your taxable income if needed. And then also from a disability standpoint, it's similar in concept, in that we can take a look, like Olivier said, at your income and kind of build a plan that's specifically designed for you.
And then kind of to piggyback on that as well, because I see that person also asked to follow up, do the rates depend on your health status? So the short answer is yes, all the time. But the bigger answer, when you talk about the company that we own, right, we would consider them side by side. What do we make as our earned income versus the company that we're owning? Janee did mention, hey, listen, as a business owner, you are privy to different realms that maybe not the average person is when it comes to retirement planning, when it comes to benefits, even certain tax deductions, right? Same goes on a disability standpoint. You can have your individual coverage where it's, hey, if I'm no longer working or I'm injured, I get paid out. What if I suffer and I'm the main head of the business, right? What happens to my business? There is protection for the actual business as well. Because I wasn't sure if you were talking about on the disability side, on the life side, things like that. So we kind of wanted to make sure we touched all bases, but there is protection for business income as well, that we can make sure that, hey, listen, if a key piece is taken out, at least we're still able to keep things running. All right.
Perfect. Would you recommend getting a financial advisor before beginning to travel nurse? It's hard to know what my yearly income will look like since I haven't started my first assignment. So before you guys answer, so as a travel nurse, I'll give you kind of a little bit of color. One, my advice and most all of our advice would be to get a financial advisor. One, you're going to be making way more money than you ever have been, and it's just going to go. It's going to go. I went on trips, I bought things, I did all the things, and then at the end of the year, it felt like I was making the same amount as I did in North Carolina, but I was in, other states and doing other things. So I personally, and most travel nurses out there, would highly recommend that you get a financial advisor before you even start making the money. Just because, one, it sets you up for success, and then you don't even have to worry about it when you start making the money. You know what I mean? You want to start yourself on the good foot and make sure that everything's covered and that all your bases and your T's are crossed and your I's are dotted. Just coming from somebody who literally did not, please do it for your own benefit and your own good. But you guys can go ahead now.
Listen,
I think you
Britt,
covered
if you want to be our coordinator, if you want to change course, we're hiring. But
right, she did a great job with that.
Like Britt stated, it's always good to actually have, if we don't plan, from our big is allowing our clients to have the flexibility. Okay, if they're making, allow them to have the flexibility. God forbid something happens, because you guys are travel nurses. As if we don't get a contract for 3 months, be able to kind of the plan to the income that's going to be slowing down. Yes, we can. On the flip side, if we haven't started travel nursing yet, but we're expecting an income jump, do we allow the flexibility to where as you make more money, you have the flexibility to put more money away and kind of readjust the plan as well? Our biggest focus, like Tianna mentioned, and she mentioned a few C's, which was confident. So one of them is to actually this kind of flexibility, and that you're tied into it. That's what I would say on that type of.
And then just to add the education and feeling comfortable with the person that you're working with. What we talked about, vetting your advisors that you're working with. Well, now is prime time to do that, because it may take time, or you may, find the right person right away. But then making sure that you find someone you feel comfortable with, and then also that they're providing with the education. So like Brittany said, once you do start making that money, things are on autopilot already. Like you already have a plan in place. We don't know exactly how much you'll be making, but we can kind of guesstimate based on our experience in working with other travel nurses what a contract would typically look like, and then put a plan together on the conservative side. So that way, if you end up making more money, you're golden. If there's less, then we just adjust the plan down, like Olivier said. So highly recommended.
And I'll also, in the email that I send out for you guys, we actually have a income calculator on our website that I'll link for you guys. So you guys can actually kind of guesstimate what the average income is for a certain state, as well as the cost of living. So it can kind of give you a better ballpark. Just for before you start your first assignment, just so you feel like you have the education and the people and the resources behind you. I know that this is personally for me, like sometimes it can be embarrassing talking about money. Sometimes you didn't do the right thing with things, so like we want to make sure that you guys are equipped and educated on all of this, because I personally don't want you guys to make the same mistakes that I know I have and my friends have, and people that will come after us have. So we just want to make sure that you guys are all good on all fronts. So I'll also link some resources that we have as well. Can you have more than one disability insurance with different companies, and is there a maximum amount you can sign up for?
So that's kind of something that people call as a stacking kind of scenario, right? So I see where you're going with there. Short answer is, within each carrier, they may have their own limitations, right? So hey, maybe I make $40,000 a month, but this particular carrier is only willing to pay a max of $15,000. Some people will go get a separate policy and stack them on each other so that they can collectively go about it. Now, depending on the carrier, they may ask, hey, listen, what other coverages do we have outside? They might take some of those things into consideration to allow, okay, this is what I'm willing to give, this is what I'm willing to do. But individually, there are limits. So what you're referring to is possible. We can stack multiple on it. It's really just going to depend, again, does it make sense for your situation? Are we kind of really getting the most out of it to do that?
All right, if there are any more questions, just jot them down and I'll get to them. Do you guys have anything else to add, or last tidbits or tips or anything like that? You have their information right there.
No.
Yeah, we would love some feedback. I mean, this was fun on my part, but I'd love to hear from you guys, audience. How do we feel? Was this insightful, valuable? Did you feel like definitely worth the time that I spent here? I could have lived without these guys.
You can't live without us.
I know, but you put it out there.
There's also a feedback survey that will go out right after we end the event. So feel free to fill that out. I know sometimes like in a public setting, it's like, oh, but the feedback survey will also go out and I can also share that with them as well. If you guys want to do it there. Awesome. Very valuable. Thank you. Awesome. Well, if we do not have any more questions,
I see one that popped up.
I see it now. Yeah.
Yeah.
I'm in the process of purchasing my house, but I am wondering if I should get life insurance before doing so.
I mean, I can't see anyone, so my apologies, guys. You were about to say something, but just my personal opinion, I believe you should, if not before, simultaneously, because just from a protection standpoint, not considering any other things, but you're buying an asset and that asset will hold value. And then once you buy a home, you have to start thinking, okay, what's the legacy that I'm going to leave behind? What happens when you buy that home? There's no life insurance. You may have children or family members that you want to leave it to, but God forbid you buy a home today and tomorrow something happens to you. Now you're leaving your family with more so of a burden, because who's paying your mortgage now? Now the house has to be automatically resold. There's so many other factors that go into place. And just the simple fact of, outside of buying a home, just the simple fact of, people creating GoFundMes and things like that, you want to be protected as early as possible, because life insurance is the cheapest, the younger you are and the healthier you are. And then also being able to protect that asset that you're purchasing.
And just to add anything, I just wanted to just say congrats, by the way, on making that happen. So
right.
Yes, that too.
Big moves.
Congrats. Awesome. Yeah, well, if there's no other questions, we just thank you so much for your time and coming here today. We want to thank Equitable Advisors for just giving us such a wealth of knowledge. You see their info there, and like I said, I'll be emailing it out, so please feel free to reach out. That's what they're here for. And we just appreciate everything that you guys are doing bedside. We're here for you and here with you. So let us know if we can do anything at all. We hope you have a wonderful night and just, stay safe out there.